This video is about the mechanism of edema formation in heart failure. Edema is an important feature of congestive cardiac failure or an important feature of heart failure. Edema occurs in the lower parts of the legs in ambulatory patients and in the sacral region in bedridden patients. When it occurs in the lower parts of the legs, especially it occurs in the angle, it is called as pedal edema. There are again pitting type and non-pitting type of pedal edema. In bedridden patients, if it occurs in the sacral region, it is called as sacral edema. Edema occurs due to three mechanisms. It can be either due to decreased venous return or decreased cardiac output resulting in increased sympathetic activity, as well as decreased cardiac output resulting in decreased blood volume. So there are three different mechanisms that can result in edema formation in heart failure. So one of the mechanisms in heart failure is it results in decreased venous return. Decreased ability of the heart to pump blood results in the venous congestion due to damming of blood in the venous compartment and increases the venous pressure. So the decreased venous return can lead to increased venous pooling of the blood, which results in increase in the venous pressure and which can cause increase in the capillary pressure as well as increase in the capillary filtration. This can result in edema formation. The second mechanism can be decreased cardiac output, that is the inability of the myocardium to pump. This results in increased sympathetic activity which can cause renal artery constriction. Decreased cardiac output also increases the sympathetic activity that can cause renal vasoconstriction. So renal artery constriction or renal vasoconstriction can be caused as a result of increased sympathetic activity due to the decreased cardiac output. This also can result in decreased GFR, which results in the retention of sodium and water. So the retention of sodium and water can lead to edema formation. The last mechanism, which can be due to decreased cardiac output, which results in the decreased blood volume. This decreased blood volume, also known as hypovolemia, can result in increased renin secretion. So hypovolemia stimulates the renin secretion. This renin facilitates the angiotensin II formation that in turn increases the aldosterone synthesis and secretion. So the decreased blood volume results in increased renin secretion, which activates the renin-angiotensin system mechanism, which results in the increase in the angiotensin II formation, which can result in the increase in the aldosterone formation. So the increased aldosterone can cause tubular reabsorption of sodium and water, resulting in the retention of water in the body, which also can result in edema formation. So increase in the aldosterone formation results in the increase in the water retention, which can also lead to edema formation. So the mechanisms of edema formation in heart failure can be due to decreased venous return, decreased cardiac output, and decreased cardiac output resulting in decreased blood volume. So decrease in venous return can cause increase in the venous pooling of blood, which results in increase in the venous pressure. So decreased venous return, that is decreased ability of the heart to pump blood, results in venous congestion and also increase in the venous pressure. This increases the capillary hydrostatic pressure that increases the capillary filtration. Thus, edema results from the increased capillary permeability. In the dependent parts of the body, the capillary pressure increases further due to the pooling of blood in the parts. So therefore, we can say dependent edema is a common feature of congestive cardiac failure or a common feature of heart failure. So second mechanism was decreased cardiac output, that is the inability of the myocardium to pump. Decreased cardiac output also increases sympathetic activity that can cause renal vasoconstriction. The renal artery constriction can result in the decreased GFR, that is a glomerular filtration rate, that decreases the urinary excretion of sodium and water. This causes the retention of water, which results in edema formation. The last mechanism was decreased cardiac output decreases the blood volume. Decrease in the blood volume is also known as hypovolemia. The hypovolemia stimulates renin secretion. Renin facilitates angiotensin II formation, and that in turn increases the aldosterone synthesis and secretion. This aldosterone causes tubular reabsorption of sodium and water. Also there occurs the retention of water in the body, resulting in edema formation. This is all about mechanism of edema formation in heart failure.